Biohacking Gut Health Part 5. What do we mean by biohacking really? Biohacking means you're using technology and science to make your body function better and more efficiently. And in case of gut health, it's to make your gut function better and more efficiently. Digestive health is the large key to the immune system health and overall health. And today we are spending the time and talking about biohacking gut health and the importance of testing for heavy metals, mold, and environmental toxins. I do want to stress this and make this incredibly important topic because there are chronically ill patients and they often go from one doctor to another, from one practitioner to another. Sometimes their blood work looks good. Sometimes the tests look fine, but they feel terrible. They feel exhausted, that chronic fatigue or even pain. And finding this root cause, it can be buried in metals, mold, and environmental issues. So, what is metal, mold, and environmental testing? This is the type of testing that identifies toxic substances like heavy metals, mold, and environmental chemicals that can be burdening your body. We could use hair tests, we could use urine tests, you could use blood samples. These tests can help uncover dangerous levels of toxins that may contribute to chronic health issues. So we are bombarded with toxins on every day, from home to going outside and being near cars. A lot of products are toxic. We are getting better and more aware, no question about that. But some levels still pile up. And if you do not test, if you do not check, and you're still feeling unwell, you really want to get to that root cause. Why it matters? Because exposure to environmental toxins from food, for example, from water, from air, can accumulate in the body over time. And again, it depends on your rate of elimination. If everything's well and your detoxification system is great, optimized, your liver's working well, you are detoxing excellent, you have less chance to pile up on these toxins. But if something's going on, if you're maybe taking medications that slow down that process, if you're doing something, if you're not moving enough, let's start from that, that can contribute to accumulations of those. And it can lead to chronic conditions like autoimmune disorders, diabetes, neurodegenerative diseases, fatigue, sensitivity. So fatigue is classic. When people can't figure out why they're tired, we often see these levels being high. So fatigue and sensitivities are, and severe fatigue, rashes on skin, chemical sensitivities. Also, it can be leading to inflammation and disease triggers. Long-term toxic burdens can exacerbate or initiate conditions like cancers and inflammatory bowel diseases, and many more. It doesn't have to be specifically those two. We are predisposed to a lot of genetically. We can do a lot of testing. We are predisposed to a lot of conditions. We don't have to have them if everything's working really well. But these kind of root causes, if you're having that toxic burden, it can be that last shooting gun that will cause this to get that condition that you've been predisposed to. So who should be tested for it? Patients with unexplained fatigue, inflammation, chronic illnesses, individuals with chemical sensitivities or recurrent rashes, things related to skin, those that exposed to known environmental hazards or toxins. Maybe it's work related, maybe it's If you're a cleaning person, maybe it's something at your job that you do daily. You probably should consider doing this type of checkup regularly, once a year, once in a few years. How does toxic exposure start? Research shows that toxic body burden begins even before birth. Studies by Environmental Working Group EWG found that over 200 toxic compounds in a quart of blood of the newborns. Exposure to these chemicals early in life can have a really compounding effect, worsening of health outcomes over time. What testing can reveal? So, heavy metal levels can reveal this. Toxic metals like lead, mercury, cadmium, which can interfere with organ function and immune health. Mold exposure identifies mycotoxin that may contribute to chronic conditions or gut issues. I've seen this over and over. When people are exposed to higher levels of mold, they're having a very hard time healing their gut condition. So that often is that last piece of the puzzle. Environmental chemicals, the detect pollutants from pesticides, plastics, industrial chemicals, also needs to be tested, because if again this could be that last piece of a puzzle in certain cases. What's next after testing? While addressing heavy metals and environmental toxins can be challenging, knowing the root cause helps you create an actionable plan. A functional medicine approach might include detoxification support, using binders, antioxidants, dietary changes to assist in toxin elimination, nutraceuticals or nutritional replenishment, replacing depleted nutrients to help the body manage that toxic exposure. Lifestyle adjustments, yeah, sometimes you physically have to remove yourself from the place that has severe mold for short term or longer term, or reducing exposure to toxins in your environment, in your home, things that you're using every day. What is the takeaway for today? Toxic body burden may be underlying factor in your chronic or unexplained health issue. Testing for metals and mold and environmental toxins provides clarity and allows you to create a targeted wellness plan to improve your health outcomes. Follow for more insights on root cause testing, and functional solutions to optimize your health. Subscribe and like. This is Dr. Ina with you at Digestive Reset. And if you have questions, if you have comments, please let us know and type them up below in the comment section. Until the next time, Dr. Ina at Digestive Reset and Melvin Institute.